Well, a warm welcome to everyone who has already tuned in. And it's a minute to go till 4 o'clock when we start at 4 o'clock. Our chief host, Kaveri, is battling some technical issues, as always happens at times like this. I hope we'll just come back to her in a minute. Otherwise, we will start at 4 as promised to our to everybody who's tuned in. Just give us another minute, please. So maybe I'll just start and we'll wait for Kaveri to join us.
Sure, ma'am. So let me just, just speak a few lines about Tiffin Talks, and then I'll just hand over to you. So welcome, good evening, friends. Thank you so much for joining us again for another amazing session on Tiffin Talks. Today we'll be talking about our cities. There has been a lot of talk about how the entire urban landscape is going to change, keeping a lot of factors in mind. There's this migrant issue, the technical issues, the fact that we are having internet classes and stuff like that. We've got a very, very elite panel with us today who will be sort of, in the next 45, 50 minutes, we'll be having great conversations on the front. And all your questions are welcome. Please put them on our chat window and we'll be more than happy to take them. I'll now hand over to Vandana Mehra, who's an independent communications consultant, and our co-host, Kaveri Bamzai, author and senior journalist. She'll be joining us in 30 seconds, perhaps, after the technical glitch is over. Over to you, Vandana. Please take it forward. Thank you.
Thank you, Pavan, and thank you everybody for joining. It's very nice to have such a large gathering. I can just see a lot of people out there. So we are going to start talking today about how COVID-19 is going to change our cities forever. And to have this discussion and to lead this discussion, we have four really eminent people. I've had the pleasure of working with all four of them at various times in the last 20 years. We will start today with Hitesh Vaidya, who will, after introducing himself, he will come back to give us an overview of what he and his organization. He heads the National Institute of Urban Affairs in Delhi, which is a premier think tank. All of you must read up upon it for those who don't know what the NIUA. And Hitesh today will come back to us in a short while and give us an overview of what, as a think tank, NIUA has learned, what is the overview, what they have learned over the last couple of months, what are the lessons emerging in a COVID world. And this is a COVID world is something we have to learn to live with in the coming months. It's not going to go away in a hurry. So what are the lessons that we need to apply? And we are learning every day. So till now, what it is that what NIU has been able to learn, assimilate, Hitesh will share with us. Secondly, after that, we'll come to Vijaya. Vijaya is an independent consultant in urban affairs based in Trivandrum. She will be giving us her perspective. After which I will guide you to Renu Khosla, who heads Cure, an agency based in New Delhi and has been working in the slums and with the poor of Delhi for almost 30 years now, if I'm not mistaken, about 30 years almost, and clearly a wealth of information and experiences to share from the field. Our fourth panelist today is Sanjay Gupta. He's based in Goa, so we are taking you pan-India today. He's based in Goa and again has worked extensively in urban affairs, including a very interesting project that we did many, many years back on small and medium town cities. Today, Sanjay will not talk about our past experiences, but more on what is happening currently and how it is going to impact the future of our cities. So I will, without further ado, take you to Hitesh now, and I will be muting myself until Hitesh introduces himself, and then Vijaya, then Renu, and then Sanjay, and then we'll be back to Hitesh. Thank you.
Thank you so much. One second, Vandana, just let you know that Kaveri ma'am is back with us. Thank you so much. Please go ahead, Hitesh.
Hi, good evening, everyone. And thanks, Tiffin Talks, for inviting me to, on this topic to discuss what should be the future of cities post-COVID. So I'm Hitesh Vaidya. I head National Institute of Urban Affairs. This is an apex institute of Government of India. It's a think tank of Government of India. The main focus is bridge the gap between the policy and practice. which we have, and that's what the role we are playing. We bring the voices of cities and advocate the policy changes at the national level. Today's topic of how COVID will impact cities. I think COVID is definitely has given us a lot of thoughts, but COVID is not the only pandemic the cities are facing. We are right now seeing earthquakes. We are also witnessing heavy rains, landslides, flooding. So while we are talking about COVID, we should really think about how resilient we can make our cities from these different disasters. So this is a first time we are seeing the disasters like such a gravity, but Indian cities have seen the disasters earlier also, and they will continue to see disasters. So how we respond to these disasters is, I think, the bigger challenge than just thinking about COVID. During the COVID situation, we saw how, what on 24th of March when we closed down and today, how much it has changed. We saw cities working on reorienting the existing services. We saw cities monitoring the COVID spread. We saw they were mapping the hotspots and responding to those hotspots. We also saw the cities managing the day-to-day operations and providing essential services. So while we all can say that cities were not prepared for, none of us were prepared for such a, not in India, but nowhere in the world anybody was prepared. But I think we should also, before saying anything, we should also see three things which has happened. As we saw during the COVID thing, no city talked about crisis in water supply. No city talks about crisis in sanitation. Nobody went without food. Nobody slept without food. So there are a lot of positive things which happened. There are a lot of challenges also we faced. But I think before saying, we should really think that cities, whichever way we criticize, our city practitioners or city officials really managed city pretty well during the crisis with all the challenges they had to face. So I think we should, first of all, I definitely think that we should give them a big hand that we today sitting and making this type of webinars every day is thanks to the city managers who are managing the cities well, and challenges are there, but they are still managing the crisis. So that's, having said that, the discourse which started with the health and hygiene has really turning out to, how we move, how we plan, how we govern, how we really manage our cities and provide equity. Just now we were talking about informal sector within the city. Earlier we used to talk about poor, poverty, informal sector in the seminars and in the discourse, but now we saw first time them people on the road. So there is a challenge. We know who are those people we need to work on. While we are debating what should be the cities of the future, what should be whether we should have a work from home culture, whether we should have a social, how we manage the social distancing norm in our public spaces, or how should we manage our public transport, whether we should really move away from dense city to a sprawl cities. These are a lot of debates, and the debate is still on. Everybody has a opinion on it. So I don't want to fix any opinion at this moment of what should be there, because what I say that what we were on 24th March, what we are today, and why we are unlocking 3.0, and you go on the road and you will find nothing much has changed, except that we put on masks and we keep little bit of distancing. But this crisis, you go to neighborhood market, you are same as you were on before 24th of March. I think it requires a lot of thinking, not only at the city level, but all the public at large, how we really respond to the crisis here. But, having said that, and again, I said, COVID has definitely amplified the crisis. But before COVID and before 24th March, if you look at it, we were short in providing water supply. We were providing water supply from, which is norm as 140, we were only 105. We were 30% of sewage was treated. We were, 24% of urban population was living in the slums. Only 70% of the waste was collected. So the challenges were already there, and it just got amplified during the process. But this, I think the COVID has given us an opportunity to really revisit and say that whether the business as usual approach will now take us to the new level, or we need to really take a step back and start thinking what should be the new normal. Even though the word new normal is it sounds like we were not living normally earlier. We actually were living normally, but it's like how we would really move forward. So new normal is a very misnomer word, but anyway, using that, what should be the, but I think rather than creating a cookie cutter solutions now, we need to really look at the long-term solutions, because the choice which we will make today, now after the crisis, will be the choice which will not only us, but our next generations have to really live with that. So whatever decisions we make, we should not just pick up the, hand in the pocket, take out a gun and start shooting. We really need to think what is the long-term solutions which we are here. So what lessons which we have learned, and I'm just giving you quick 7 lessons which I think as an individual or as an institution which we have learned during this crisis. And I think they can be a short-term lessons for next 3 years. And while working on those lessons, we should think about the long-term strategies. And these 7 lessons, which I see, and we need to really look at it. We have seen investment in data and technology will yield exponential results. So I think the major focus which we saw, and people who are on the roads, we don't have even a data on who are the poor people in our cities, how many people, what type of people. So that's one area. Second lessons which we learned is we need to really revisit our city planning instruments, and I'll come back to them when my time comes. I'll just highlight some of the issues right now. So we need to revisit city planning instruments. Third, which is we need to really look at strengthening our local governance frameworks. And also, because we saw this time so many sanitation challenges we saw in the cities, we need to really look at the capacity tools with the new skills and new tools provided to the people to handle this crisis. And we also saw how we need to have, cities need to have funds to manage this crisis. So how cities can become financially resilient, how we can really go on devolving funds to the cities so that they have a flexibility of managing this type of crisis. Then, like the way the informal sector, we are thinking that we need to see, we don't need to city in isolation, but city in the whole ecosystem. So city has to have a look at city and its urban sprawl or its region. So it has to be a linkage between urban, rural continuum, which we need to work on it. So we need to look at a city as a regional entity, not as a city as just a city as isolation. And 6 things which we really thought about it. This time we saw how civil society, local governments, and other departments of the ministry, they converge together. So the collaboration architecture at the local level has to be really thought about. What should be that new collaborative architecture where we think about one unified leadership of urban local body, which can then take a decisions rather than 3. And we saw this happening with the integrated command and control centers, which happened across the city, which were like, I've been part of Smart City Mission. When the Smart City Mission was launched, these integrated command and control centers were looked as a white elephants. But this time they came into the rescue of people gathering the data, in monitoring the situation, responding to the situation, and looking at the recovery of methodologies or recovery solutions to this crisis. And lastly, which we saw, then we always forgot the 7th lesson is so citizen is always looked as the last. They are given again. So how do you really bring citizen in the focus of planning? It's for whom we are not planning for building, we are not planning for infrastructure, but we are planning for citizens. And how do you really bring that voice of citizens in the planning discourse? I think that's going to be the biggest challenge. So if we really want to make better recovery and build back better, we need to really think about these 7 principles for a short-term measures, which then can lead to a long-term measures. With this, I just stop it and I come back later on while the question answer and explain much more at that time. Thank you very much. And I hand over to Vandana and Kaveri again back. Thanks.
We'll ask Vijaya to speak now.
Yes.
Vijaya.
Hello.
Hello, thank you, Kaveri and Vandana and all the panelists for having me. Very happy to be here. My name is Vijaya. I am a consultant in the field of urban development and water sanitation and hygiene for the last 20 years. I will start with some opening remarks about the pandemic and the city, since that is our subject. I mean, cities have had a very long relationship with pandemics. If we go back to history, we see that, the city of Athens, Tenochtitlan, and later Constantinople all fell to, pandemics. Right through the 19th century, where in the 19th century, cities then learned to adapt. They learned to overcome the pestilence and the pandemic by putting in place, solid waste management systems, by putting in place sewerage systems, by putting in place clean water, etc., and managed to, also initiate medical innovations, pasteurize food, and so on and so forth, and really put public health at the center. And we see that even in India in 1918, when the Spanish flu uh, had a fatality of about 18 million Indians, there was still a lot of sanitation engineering that was done, and cities were able to adapt. Even cities like Bombay and Chennai, which were very badly hit, were able to actually overcome it. And it also, the accompanying famine and other things also resulted in, galvanizing people against the colonial powers, and catalyze nationalist sentiments as well. And recently we have the example of the Surat Plague in 1994, where Surat went through a very devastating experience and then managed to reinvent itself. I don't think it will be very different for COVID-19 either. I agree with Hitesh that I don't think there will be fundamental changes in the way citizens relate to cities, but also that there must be some changes in our response so that our cities can be more resilient in future. So I will just close with these opening remarks and come back, in the next round, if that's fine.
Sure. Renu, could we talk a little about the Atmanirbhar household that you had mentioned, and the stratification of the poor in the slums and the very poor who are invisible to us?
Briefly to introduce CURE, my name is Renu Khosla, the Center for Urban and Regional Excellence CURE. We are a development organization. We have a living purpose, and that is to transform the lives of the urban poor people by improving their access to basic urban services, which is water and sanitation in particular. We seek to bring in social infrastructure that would enable them to have taps and toilets at home. Essentially, we try and incubate, simplify, de-engineer this infrastructure so that we can create healthy, safe, clean neighborhoods. So essentially, we do call ourselves an unthinking organization because we try and innovate solutions and build ecologically resilient habitats. 5 opening thoughts. What does it mean to be invisible, unequal, and quote unquote worthless? If we look at our cities, and if we look at the most defining image of the pandemic, which was migrants walking home, I think it was a moment of truth for all of us. It was an awakening. It was a shout out for me in particular, because for the first time, for organizations like us and for people like me who've been working with low-income slum communities for now several years, it never struck us that there is poverty beyond the geographies of slums. It never occurred to us that there could be people who are sprinkled across the city. And it was it was a devastating and a very, very depressing sight when we saw all of them walking home. We went back and checked in our slums, and we found that 3 in 10 people actually have walked back home. We also found that 3 in 10 are out of work, and 3 are in desperate employment. The tailors, the masons, the plumbers, the vendors, the dhobis, they are all waiting for businesses to come back to normal or a new normal, whatever we may call it. In touristy cities like Agra, where we work, the tour guides, the auto drivers, the souvenir makers, they are awaiting tourists. There are no tourists, so there is no work. And who's been hit the hardest? The women and the children, because women and children do not have the mobility or, in fact, even the entry into some of our homes to do domestic work. So, essentially, where were these people? I think they were coming out of factory floors, they were coming out of dhabas, they were living in garages, they were sleeping on rickshaws and carts, they were over bridges, they were sharing rooms, they had beds, they used to do a share room, they used to share beds by shifts. They had common taps, they had common toilets, which were filthy and unhygienic. There was no way they could have maintained social distance, nor could they have maintained hygiene, and neither did they have the money to pay the rentals over there. So I guess the first question in a post-COVID environment is to ask ourselves, who are these migrants? Do they have a right to the city? Or are we still expecting these people to go back and to come and work here, but to return? Because migrant in itself indicates that you are not a resident of. My second point is that this divide is huge. This inequality between the poor and the rich has been growing. Our cities have become highly unequal. They're getting different levels of services. They have different access to the local governments. Their voices are feebler, and they are more invisible. So how do we make sure that the COVID devastation can be used as an opportunity to change this injustice into a more just city for the poor? Third, I think the most critical piece of this architecture of revitalizing our cities is going to be to reconstruct the livelihoods of the poor. Just like businesses all over the cities or all over the country, let's put it like that, have floundered and have been given this huge stimulus package. I know vendors and all have also been given the packages, but I think they need a lot more support to put their businesses back and to start earning the kind of money that brought them to the city in the first place. My response to your question on will cities change forever? Will this change be permanent? Will migrants come back? They are coming back, but I don't think the cities are going to change. I don't think it's going to be a wrinkle ironed here and a tweak there, but I think it's going to stay business as usual unless the willingness to change and all the 7 lessons that Hitesh pointed out are actually acted upon. And finally, we do have the magic mantra of Atmanirbharta. And I think if we want to be an Atmanirbhar Bharat, we need to take care of our poor. We need to make sure that they are our healthy, productive citizens who can contribute to the revitalization of this economy. That's my opening.
Yeah. Sanjay, can we have you now? What are your thoughts on this? Especially, I think, 2 aspects. One is the digital divide and the idea of work from home. Will that be a permanent solution to the work culture?
Yeah, thank you, Kaveri. I'll just, start, with maybe a minute of opening remarks.
Sure.
I think the last few months have been, I would say, dramatic and definitely historic. And will this leave a permanent impact? Yes, I think it is going to leave certain permanent impacts. I think both for the better and for the worse. And some impacts, I think, also present opportunities, which I'll come later on. Now, let me say, okay, what I think has changed for the better. I think there is an increased consciousness for higher social security, including for the migrants. We have been focusing a lot on social products and social security in rural areas, but not in urban. I think now there is a very heightened amount of consciousness and a felt need. You talk among development professionals, you talk among the government is talking of one nation, one ration card. It wants to de-link social benefits from the place of birth or domicile. So that definitely, I think, is a very positive learning that has emerged from the migrant crisis. It may not help 100%, but it is definitely, I think, a very positive change in the right direction. The second is, I think, we definitely have an improved environment overall. We have lesser use of four-wheelers. We have more e-commerce. We have lesser going out. And we have seen, that we actually can have cleaner air, cleaner water quality in our city, with a change of lifestyle. So that presents us an opportunity, I would say. But one, I think, negative on the environment is the increased use of plastics. Whether you take masks, you take PPEs, you take any kind of packaging, I think they are just using more and more plastic. And several state governments have actually done away with rules that require phasing out of plastic. So that's on the negative side. I think we have a much more resilient economy now. I think companies are realizing that, individuals are realizing that. So I think this is, in the medium term, really going to strengthen, make our economy much more efficient. It is going to, root out a lot of, inefficiencies, costs that were not really productive. And also, I think what is going to happen a lot is the formalization of the workforce. India has a unique data of actually having about 90% workers, in the world. 90% workers who are informal, which means they don't have a formal contract or a formal work arrangement. And that is also partly what led to a lot of the crisis, that we saw, the employment crisis. And now there is, I think, more and more focus going to be on formalization of workforce, which will in turn also allow micro and small businesses. We hear of businesses which are the same as they were, 3-4 generations ago. That is again something very unique to South Asia and definitely to India. So with formalization of both micro and small businesses and the employees, the workforce, we're going to see, I think, much more robust economic growth. Coming back to, I think, what you were saying, Kaveri, the digital divide, definitely. This digital divide, in fact, has actually worsened. While we glorify the work from home, that is a luxury really for the privileged. It's not a luxury of everyone. Forget working from home. We can't even have study from home for students. India itself has 320 million students, maybe 32 crore students who are right now without any form of education. Out of that, maybe a small percentage, 2%, 1%, 3%, I don't know, have access to your digital devices and to the internet. So they are the only ones who can, and that too assuming their school is also providing them the same. So this has only heightened. How many of us can really claim to work from home? Really not. Maybe again, 2%, 5% maximum of India can really work from home. So even this whole thing of, this work from home shift that is happening is going to be very minor given what our socio-economic, our socio-technological challenges are currently. And let's not forget that women and girls have far lesser access to smartphones and internet services. Do we know that families invest for girls' education who traditionally not invested anyway into giving digital devices, internet? Of course not. So we're going to have a lot of girl children, especially, not come back to school after what I perceive will be at least 1 year of break. If you go to any country where a war happens, any reason kids drop out of school for a long time, the girls don't come back to a large extent, and that is something we're going to lose, a full generation of girls actually not coming back to school. The women definitely, I think, have become far more vulnerable. Renu, I think, touched upon it. If we look at all data, we look at McKinsey report, women are nearly twice as likely to lose a job compared to men in these times. And another factor is that women in India, including South Asia, spend 6 times more time on unpaid domestic work and care than men do. And that demand during these times of COVID has only increased, which means women are having to do work, women are having to take care of children, women have to take care of the elderly, the ill, and they also have to focus on teaching the children who anyway are not able to attend school. So we are really placing a lot of burden actually on women. Pregnant women, we know, are being turned away from hospitals. I think India has really achieved quite a bit in reducing both infant mortality and mother mortality, But now we are reversing that trend. Because of the scare of COVID, we have done away with our so-called normal healthcare services. Doctors, whether in public sector or private sector, abdicated their responsibility. Our healthcare sector really didn't live up to the mark at all in attending to the needs of the poor, of the middle class. I think they only cater to privilege, whether they were politically privileged or financially privileged. Domestic violence against women is on the rise. So that is another huge change that we are seeing. So, but there are, as I said, certain, I think, opportunities, and we can come back to it later. Thank you.
Very well said. Vandana, would you like to step in here? Okay. Can I ask Hitesh? Hitesh, one of the things that every panelist has said, and in fact, Rajnath Singh as well said that they had no idea that there were so many migrants, that there were so many invisible people, so to speak. They had underestimated it. So your first remark was that really we need the data to understand what is the size of the problem we're looking at. So can we finally have a sort of an idea of really how many invisible people are there in this country who are working everywhere? I mean, they're running the telas, they're running the shops, they're helping in running tea stalls. They're everywhere, but we have no idea of how many there are.
Yes, I think the data is a challenge, and that will remain a challenge for some time to go, because we really need to invest in data. At this time, if we don't, our policies and all are not made on any evidence based. We have a segregated data, fragmented data. So unless we start collecting and integrating and interlinking the data, will not work properly. And I think, and that is what I was saying, when we have an integrated command and control center now, where we got the data from different, from the people directly, from the different agencies putting together. Now we need to really invest how we start collating and putting it for a policy discourse or policy evolution. Right now, there are different sets of data. Even just now, Sanjay was talking about health. The health people which collected the data, the hospitals which collected the data, workers, the health workers which collected data, how that all data then now should be actually collated at one place at a city level, which gives a data for a city. And I think one of the area where National Institute of Urban Affairs is right now working with working with Renu ma'am and other people of the same thing, is to create a platform where different sets of data can then be collated through different technological interventions, and it becomes useful for a city to really make decisions. I'll give you an example, and I particularly feel in the city, the most marginalized, if you really look at it, is the people with disability.
Yeah.
While we don't know how many people with disability are there, and their accessibility to these health facilities, their accessibilities to the economic activities which Renu and others have highlighted, and that's an area where National Institute of Urban Affairs is targeting. We are starting to build a database with the people with disability as a starting point, and then starting linking it with other data. But that's a starting point, and one of the lessons which we learned, that we did not have a data at a city level. And I think this really forced us to work, and ministry has already started working on this agenda of data. Ministry has already started working on creating a data strategies at each city level, how that can be managed, how that can be interlinked. And I think this exercise, that's why I'm saying that the interventions which are medium term, short term, and medium term, which is like 1 year to 3 years, is one of the lessons is we need to build more and more data, because invisible people which we saw on the roads, which they now have become a big concern, and not only civil society has seen these people and highlighting this issue. This is, I think, government has also seen this challenge and is focusing on bringing more and more information at one place for that.
Right. So we need some sort of register or some sort of database which is national and which covers all this.
Yeah.
Renu, may I ask, you were talking a little about the Atmanirbhar household. We've heard of the gated community where, water is privatized, electricity is privatized, you have your own genset, you have your own water, you have your own security system. Are we going to see it at the household level as well?
As Sanjay says, it's a luxury.
Yes, of course.
Be gated. It's a luxury to be able to sit inside your homes in the COVID times and
in this bubble. Yeah.
It's a bubble. We are living in a bubble.
Yeah.
We cannot afford to be in these bubbles because I think you cannot power an economy by creating this. Right now, there's a sense of fear. I think people assume that as soon as the vaccine is out, it's going to be fine and people will go about their businesses. As far as Atmanirbhar is concerned, I'm not sure if this is what the Prime Minister meant when he meant the Atmanirbhar. But if I look at it from the lens of the poor, I do believe that poor have been Atmanirbhar all this while. What is it that they get from the government? They fend for their own, spaces. They are looking for, water is given to them in tankers or in sheer taps, and they are struggling to get water. They're struggling to go to toilets. And during the time of COVID, there was a queue, long queues, because everybody was at home and using the community toilets that were provided. Otherwise, they use toilets at their employers' places. So having, said that, I still believe that if we seriously understand the concept of Atmanirbharta, which is becoming self-reliant as a nation, as a community, I think there will be two key things that we would need to do. First of all, we need to create a healthy population. And to create a healthy population, we need to be able to provide them access to taps and toilets at home and decent housing and decent livelihoods. And hopefully the registry that we are talking about will be able to put together all this database so we can better target the solutions. During the COVID times, not everybody had a Jan Dhan account.
Right.
Many of them had, allowed it to lapse. And so there was no way money could be transferred to the poor people. And that's why, NGOs had to step in to, fill in the gap and provide the relief services. The second thing, I think, in an Atmanirbhar Bharat becoming self-reliant is going to be participation. We have to engage. We have to have cities talk to the people. So far, I mean, just going from what Hitesh has talked about, the data, I do believe that the data is flowing in one direction. It's just being collected by the decision makers and the policy makers, and they see to use it as, as they wish to use it. But they're not talking to the people. They're localizing this information. They're not engaging and participating. And unless we engage, unless we involve and have people generate their own data and people be responsible and take ownership for their own services, it is not going to become an Atmanirbhar Bharat. So for me, there are two key challenges here that the cities need to work towards.
Right. Which is creating a healthy population and ensuring that there's participation.
Ensuring that there is participation, and of course, the people generate their own data. It is my data that I should be able to, give up to the city. There are lots of data challenges. I mean, if you sit down and look at it, we need to spatially map where these people are. We need to, combine all the social services that we are providing to these people so that we know. And digital, today there is enough technology for us to be able to put this data together so that we know where the gaps are, where do we need to invest our energies. I do believe that data is the future, but then again, coming from what Sanjay has said about the digital divide, it means that people like us who know how to use the IT tools to interpret this data, to be able to access various services, we are going to, it's going to be another unequal city. It's going to be a city which is going to be divided along digital lines, those who know and those who don't have the skills, those who have access to the instruments and those who don't have access to the instruments. So I think we need a lot of work around that.
Aditi, may I come in for a minute?
Yes,
if you don't mind?
please do.
Yeah, I think it's a fallacy that nobody knew that there are 50 million, over 5 crore migrants in the cities. I mean, anybody who is saying that really doesn't know what he or she is talking about. In fact, the whole poverty elevation in India has been fed by the fact that we had huge migration from rural to urban areas, and that the urban labor rates were on the rise. So if you look at the last 2 decades, the major contributor to poverty elevation in India, the reduction in poverty rates, has been migration and the increasing income of migrants. So, I mean, everybody knows this. So I'm just, number one. Number two, the problem with data is we have data, but it's completely linked to your domicile, where you were born. So your Jan Dhan account, your ration card, your healthcare benefits, everything. We don't know about anyone who really has shifted from his or her place, and we are a country of migrants. So we have totally failed, and we can keep talking about data. Let me tell you, I'll be surprised, pleasantly surprised, if they can even do this in 5 years. I'm not even assuming it will happen in 10 years. So we need something really in a mission scale. We don't need to keep talking about, data. No, we know what is to be done. So let's get on doing it, instead of really thinking. I mean, this is a difficult task by any standard. It's not easy to get all this data because nobody also wants to be documented. There's so many other issues.
Yes.
There's no trust on the government. I wouldn't want to share my data with the government. Nobody trusts the government, honestly, with a lot of personal data. But employers don't want to know how many they're employing because of PS rules, because of so many other formal business rules. So let us realize the challenges, I think. This is not going to be easy. I mean, we can keep talking about data, but if they get in a decade, they should feel happy, honestly.
Sanjay, what would you say then is a solution that we can implement in the short term to at least contain this crisis, or to at least reinvent ourselves? Otherwise, we'll just go on with business as usual.
No, I think the cities need to become more responsible, because right now, the whole responsibility for social protection, social services is not where you are, but where you were.
Where you were. Right.
So the cities that are benefiting, I think, from all these migrant workers, the businesses that are benefiting, the households that are benefiting, I think they need to start contributing to this. And the city governments really need to call a spade and start doing it. I mean, we have very weak institutions in cities. They cannot provide us bare water sanitation services, and we expect them to take care of migrants. We really need strengthening of our city establishment. We need our urban ministry. We need our education ministry to start doing this. We don't even know how many kids are in school who belong to migrants who have now gone back. We don't even have that information.
Right.
So I would say it is wholly the responsibility of the urban government, of the communities who are benefiting from it. And we really need to start strong consultations within communities, with the poor, with the rich, with the government, and start finding solutions which are practical, which are equitable, and which are acceptable. We cannot be a big brother approach that the government currently is taking of. I will collect data. Who will share data? Nobody will share data, so it will continue forever.
Right. I'll come back to both Renu and you, Sanjay, with practical solutions that you've seen maybe at a smaller level, which you feel can be scaled up. I think that'll be something that we can look at.
Yeah.
Vijay, yes. May
Yes.
I request you to step in? Yes.
Yes. So on the picking up from what was said earlier on the data, we have a 2016 report on migrants, a working group that was constituted by the Ministry of Housing and Urban Affairs. So here it is clearly recognized the issue that Sanjay talked about, that the main issue is that people are delinked from their domicile. They are multi-local. There are seasonal, migrants. They're not permanently residing in. I mean, there's a lot of typologies that we see in people who are migrants. In 2020, I think Amitabh Kundu also came out with this data set where, about 65 million are workers, and out of which 65 million are the workforce, of which more than 30% are informal. So I think it is in this informality that the crux of the matter lies. And unless, there is a need to reveal this data, or there is a benefit from revealing the data, I mean, like Sanjay said, people will not be willing to come out. So I just like to give an example from the state I come from, Kerala. So here there is a large migrant population from the North Indian states, especially from Bihar, UP, Jharkhand, Assam, Bengal, and Odisha. About 2011, our government started a system of, ensuring the migrant workers for health under the Construction Workers Welfare Board, where up to about 25,000 rupees worth of health insurance, health treatment was given. Their children would be given free education. Even the migrants themselves would have access to adult education under a specific program called Changadi. There was yet another initiative called Apna Ghar, which was about providing affordable housing like dormitory facilities or government-owned collective facilities for workers to live in safe and hygienic conditions. So this required workers to actually register themselves. So, this is a small scale initiative right now. It is obviously not covering all the workers because some of them are associated with contractors who do not necessarily reveal, some come on their own, etc. And then you have the informal workers within, the intrastate workers who are also equally informal. So till such time there is like a labor bank where, as Sanjay rightly said, the local government takes initiative. It would probably not take off. But the report on the working group on migrants, they've also come up with this recommendation that there should be portability, which means if whether I'm in Jharkhand or I'm in Odisha, I should have my entitlements should be portable. So if that is to be necessitated, then it requires concerted action from the center, state, and the local government. And we are talking about one nation, one ration card. So if you need that to work, obviously you need to compensate the state for, the extra that they're giving out from their ration. So obviously you need to work out some kind of a formula for the states as well as the cities in turn then to make these entitlements available to the migrant workers.
Yes.
Right?
Renu and Sanjay, may I ask you to give us some interesting examples that you've seen where solutions have been found by local communities and which you feel are scalable or replicable?
Want me to come first?
Yes, sure.
Okay. All right. All the solutions that Cure, implements in the slum communities of its work, these are all local. These are all curated in partnership and with the participation of the people who also contribute to these. Simple ones, I mean, if I bundle them under services, then for bringing toilets at home, it's about putting simplified sievers. So it's about making a simple, shallow, thinner sewer which can go into the organicity of a settlement, which is easy for it to navigate that. We found we did it in one, and we had at least 5 settlements who just grabbed it off and did it on their own in 5 different settlements, and with a much lower costs and much faster than we did. It's about bringing pipelines inside the slums. I mean, how hard is that? You bring in a stand post. Why can't you extend that to a household tap? People in urban areas, as I think Sanjay mentioned, that there is income. They are willing to pay for the additional water convenience of having the tap at home. So bringing in taps inside the home. Rainwater harvesting has been another one. Community rainwater harvesting, which is actually something that the city must partner with local communities, because in the city of Agra, we built 7 community rainwater harvesting systems that generate 10 lakh liters of water annually and save the city 30 crores of rupees in supplying water, treating water, and the ground extraction of water. So they're actually becoming resource generators for the city, and the city needs to take this on and expand and extend this. I think there are many examples. Another one which is around the data one, which is what we call UrbGov or urban governance. It is a spatial, geospatial data decision-making assistant, which we have been piloting with about 15 municipal corporations now. It democratizes data. It helps the community, the people's data to be integrated and to reach up. It helps to identify where are the gaps in services, where should the investment go. It helps the city take some sensible decisions to spend the money better. So there are a lot of examples. I mean, I'm giving you examples from Cure, but I'm sure there are a lot of examples all over that could be.
Thank you. Sanjay, we all talk about urban governance, but we all know how poor urban governance is in most cities. So have you seen anything that has struck you as being inspiring and being replicable?
I mean, let me give two very specific examples.
Yes.
One is, I think, the state of Kerala. Let me go back to that. I mean, if we look at post, March, in April onwards, I think Kerala actually provided monetary benefits to all immigrant workers who lost a job.
Right.
Okay. So that allowed them to fully collect data. See, if I know that I'm going to get 1,000 rupees a month, I'm going to come forward and register myself, and they had a separate scheme for migrant workers, a separate scheme for people who return from the Gulf. As we know, Odisha also has a lot of people going out, and that's why hence the need for people to come in, So they actually delineated all these benefits, and they gave benefits to everyone. So they actually were able to not only develop a good data set, they were able to monitor much better the health.
Right.
They were able to provide, I think, entertainment programs in their own local language for these migrant workers. Because a lot of migrant workers, Odisha, in Kerala, are actually from West Bengal. So they were able to provide those in Bangla, in Odia language, whatever suited the migrant workers. The other, I think, a great initiative, which actually I would say has helped quite a bit, perhaps not in particular in COVID times, but before that, I think is the Mohalla Clinic right in Delhi.
Right.
Which was, I think, a very good partnership between the private sector, which was the private, physicians, and the government, of designating their own clinic as a government-run clinic for a limited duration every day, for certain days a week. And I think that really democratized availability of good healthcare at zero or very low cost for everyone. Whether, as long as you were there in the city, of course, we did see, if you remember, we did see attempts by the government of Delhi to say it is only for the quote unquote residents of Delhi and not for outsiders, which I think was a very, regressive move. And thankfully, the government listened to people's voice and did not follow that. But I think that is again also, if we want to really do it, I think if our intentions are right, then enough. Problem is not examples, problem is intention. I would really say that.
Right, I agree. Vandana, would you like to ask Hitesh?
Yeah, hi, Hitesh, if you're there.
I'm there.
Yeah, okay. Hitesh, any last words from you? Because we actually have almost 8 or 9 questions and some of them are directed at you. And I'd like you to answer one or two of them before I pass on the questions among the others. So,
yeah, no, so, I think all the issues which Sanjay has highlighted and Renu really brought out, and I think they were quite good, but I just, again, go back, 24th of March, none of us were prepared. So you really give, we have institutional and governance issues which are inherent, that nothing to do with COVID. They were there before, and we have to resolve them. But I think how the cities, with all the governance challenges, and I can, we can have a separate debate on governance, still work that today we are in the luxury of our rooms, we are having this webinar. What they did was, disseminating important information through command and control centers, setting up a smart city labs, which are the COVID war rooms, which created the apps which were developed by citizens. And this all actually happened with the city's civil society, people together. Okay, the complexity and the scalability of India, is definitely a challenge. But, just saying that urban governance did not work, I don't agree with that. I think we have a challenges of urban governance, definitely there. But I feel that with all the challenges, how we managed this crisis is a lesson learned and opportunity for us to really take this forward and, start with a small interventions to a bigger inherited issues which need to be worked on, because one of them was 74th Constitution Amendment. We are still not able to implement that in full form. So that's a larger governance issue. Maybe we may need to go back to the drawing board and see why it would work, why it did not work. But having said that, I do agree that there are governance challenges, there are urban challenges, all which have been highlighted by Renu and Sanjay. But I think, given that we still have, with all those challenges, cities have stood up and we did manage, numbers. If you look at numbers, also the way we are getting treated, the way people are thinking, you can debate there can be less or more, but I still think that there is a system which is working down there. You can't ignore that at all. That's all I can. Yeah.
All right. Thank you. Now we have a lot of questions, and I'm going to go one by one and ask Renu. I think I'm going to put this one to you. This comes from Jayanti Seth. She's made one comment about garbage disposal, and she suggests that this is something we need to think of very urgently, as landfills have not really worked. And look at the disasters that have already happened is something that Jayanti says. But her question and that's a comment. And the next question, maybe Renu, you would like to take this, is can the answers to better housing and health of workers be found by individual effort? Isn't it more of a community effort or a government effort? So how would you like to respond to that, please?
It has to be a combination of the three. First of all, we cannot, as far as the poor are concerned, we cannot that they will bear the burden of producing their own housing and also, be able to improve their health. But having said that, the way housing is being curated or by the government is not the appropriate way. You have to provide housing which is closer to work sites, but you also have to provide housing that can incrementally grow, that people can invest in by themselves. So it's about what are the kind of options and solutions you take. You can have housing where you can just give land tenure. You can just tell the people, okay, we're not going to shift you here for 5 years. As long as you are in the city, we're not going to move you here. We don't need this land. So people will invest in their own housing. But as I said, it has to be a combination, and there are many solutions like infrastructure. When you need to bring in, it has to be a community effort. It has to be maintained, it has to be managed, therefore O&M systems have to be there. And I would say only a combination of the three can work. Government that brings in the enabling environment for something to happen, and also the big finance. The community that gets together to design to the localized solutions and to maintain and manage and to use these appropriately, and the individual who contributes to all this effort by investing in his own housing and health. So that's what I would say would be the solution.
Thank you. Thank you. I have another question and I'll ask Sanjay to come in for this. Sanjay, Lata, who is based in London, asks, are we all supposed to be going either the entrepreneurial or the individual consulting way to ensure that the distance and socially aware aspects, which may become a permanent part of our lives? I think they are already a permanent part of our lives. What happens to corporate social responsibility? So I thought this was a question you could take.
Sure. Thank you, Vandana. I think we are really jumping ahead of us. If we look at the Spanish flu, the last big one, that hit the world. I mean, it lasted for 2 years, and it was in a time when there were practically zero medical facilities compared to what we have today. I mean, maybe 5% of what we have today. So I mean, so I don't anyway expect. I mean, even without a vaccine or without a cure, for COVID to really last for more than 2 years, 2.5 years anyway. It's a virus. Sooner or later, we will attain immunity. Mass immunity against it. And it's, I mean, work from home, as I said earlier, is really a luxury. I mean, in different societies, in different cultures, with different kind of logistics support available, it will happen. I mean, and it has been happening irrespective of COVID. If we even look at data from India, last year we saw firms consulting out by about 30%. So they were giving to individual consultants work rather than hiring employees. And this is data until March of this year, so which has really nothing with COVID. And that trend is basically rising because we have more information technology, we have more automation, and I think we have several category of professionals who are able to work remotely. So, and we are also entering the area of, era of specialization, where I think managers and administrators are soon going to be losing a lot of jobs. So I think that is a trend that will continue irrespective of COVID. COVID may have accelerated the trend a little bit, but I don't think it is the determining factor in that at all. Thank you.
All right. Thank you, Hitesh. There is a question, interesting question from Pranita Agarwal on how will cities support the invisible and their lost jobs? Will this mean some form of livelihood creation beyond the cities? Is this something you'd like to take on and respond to, Pranita?
Yeah, thanks. I think that's the biggest challenge right now the cities are going to face, which is how you really manage the invisible. And I very sincerely feel that there cannot be a top-down guidebook which will work for this. There will be something, because it has to be, and there will be no one-size-fit approach also. It has to be contextualized, it has to be localized, it has to be worked as city by city. So I think this question actually go back to our planning instruments, and that's what we need to really look at. Right now, the whole approach, which is we have right now, is a master plan approach when we think about a city. And when you have a master plan, only thing which we are looking at city is a city in its silo, and it's giving them a zoning and creating those ghettos. So we need to get out of our planning thinking of how do we plan our cities to a more of a master planning approach, to a strategic planning approach, and look city into a region context where city is not only getting benefited from its hinterland, but also contributing to its hinterland. So I think that's the broader approach which we need to really think about. And for that to happen, I think, again, we need to get back to our governance structure, which is a very big issue, because at this moment of time, who owns our city is a big challenge. We have a one-year mayor who is has, before he starts his job, the time is over. So we need to really look at, and we have a multiple authorities which work in the city. So how do you converge? And this time, I think the COVID, one thing which good has happened, first time we saw the convergence happening, both have a health and planning instruments. And we need to build on those learnings at this moment of time. So that's another thing. But also, I think, what I think the COVID, which will give this new thinking, is we also need to go back to these visions which we're working with, which is a top-down, central-driven visions, to really think about demand-driven thoughts coming from cities and moving upwards. So whole planning has to be driven from the bottom up to top down rather than what we have inherited, the whole idea of top down approach, where sitting in Delhi we decide what cities should really look like. So I think these are the bigger challenges which we need to do. But if we really want to have intervene for the invisible, I think all the projects which we need to be working on, we need to, I will call it a fourth thing, and I call it like, cities has to rise. When I say rise, means they have to start preparing their interventions as a result oriented, not only 1 or 2 pilots and then build on it. So result oriented, what is the result? They have to really look at what is the impact which these interventions are making. And they have to see how from the pilot it can be scalable to a city at a large. And lastly, equitable, which is, I think, has been highlighted quite a bit already. So unless all the interventions are looked at in these 4 broad parameters and start rethinking of city planning process, we are talking about, it will be a business as usual approach. So if we really want to move at a new approach of working with the cities, we need to really start thinking on these 4 or 5 parameters which we are talking.
Okay, great. Vijaya, before we close, there's one comment that I'd like you to address. Jayanti Seth had asked about garbage disposal and landfills, and I know that you have some experience in that field. So would you like to respond to her? What better efforts can be made to avert the disasters we are seeing in almost every city connected to either garbage disposal or landfills? What are the best options going ahead? The situation is getting worse every day on that, as we know.
Right. I mean, I do not have any ready solution to this, but I think the way is to have a zero landfill situation, and segregate and treat as far as possible at source. And sure, I mean, as Sanjay was mentioning, COVID and its the attendant, the use of plastic has come back, the use of disposables have come back, PPE kits, all these. So biomedical waste disposal definitely requires a lot of attention here. And I believe a lot of this is finding its way into the municipal waste stream, which it should not. So there should be really strong regulations around biomedical waste and a possible recategorization of what constitutes biomedical waste, which includes, sanitary napkins, all of this, which at some point the Pollution Control Board had thought about and had written to states to actually categorize them as biomedical waste. And so they should be treated as hazardous waste and, treated and disposed scientifically. So this is ideally what should be done.
Okay, great.
Thank you.
Do we have time for one more question, or are we over time now?
We can ask a quick question, Vandana. One last question.
Okay, I see Sanjay Gupta has already answered Vivek Raman's question online. So we can...
Vandana, the Vivek Raman? Vivek Raman? Okay. Hi.
Okay. Well, you can read it on the group chat, Zoom group chat on the bar on the side. So for me, I think this was, as my first moderator, this was a fantastic do, but I'll give it over to Kaveri to close now and thank everybody.
Thank you so much. It was really enlightening, and I've already got, ideas for so many articles that I want to write, and I want to take off from here. So you'll be hearing from me soon. This is not the last that you've heard from us. Thank you so much for your insights. It was really most beneficial. May I request Ruchin Kohli to quickly give the vote of thanks, and then you'll all be free to leave. Thank you very much for your time. Ruchin, yes.
So I would say what an insightful session on our cities and the urban landscape. And I'm sure all our viewers would have been benefited a lot from these views and will take something back to help make our cities a better place to live in. With this, on behalf of Tiffin Talks, I thank all the panelists who gave us their valuable time. I would also like to thank Vandana and Kaveri ma'am for moderating the session so seamlessly. Tiffin Talks is trying to bring some really interesting conversations, keeping the current times in mind. Keep following us on Facebook and YouTube. Thank you. Stay tuned. Thank you for now.
Thank you. And we'll be sending you the link soon. Thank you so much.
Thank you.
Bye.
Bye.